suture materials. So suture materials are divided into two. It includes the absorbable as well as the other one being the non-absorbable. So firstly, we are looking at the absorbable. So under absorbable, there is presence of catgut. So catgut is nothing but it is a plain and chromic type. And what are the uses? The uses is that it is to ligate superficial vessels. For ligating the superficial vessels. And also to suture the subcutaneous tissues as well as the stomas and other tissues that heal rapidly. Next we look at another absorbable suture. It is the polyglactin. Polyglactin is nothing but vicryl and it is a braided multi-filament. And what are the uses? The use of polyglactin is for the gut as well as the biliary anastomosis. They are used in the vascular ligature. They are used in the kidney as well. Kidney and the ureter surgeries. As well as the subcuticular wound. The other absorbable suture is the polydioxanone. So this is nothing but a monofilament and it is dyed or non-dyed, undyed. And where is it used? It is used in case of the tissues, in tissue where there is slightly longer wound, longer wound support is required. Wherever longer wound support is required for the tissue, it is used. Next, we move on to the polyglycapron. So in case of the polyglycapron, it is nothing but the monocryl and it is a monofilament. So what are the uses? It is used in case of the subcuticular suturing of skin and it is used in case of the soft tissue ligation as well as it is used in the gastrointestinal as well as the muscle surgery. Next, we move on to the non-absorbable sutures. So in case of the non-absorbable sutures, it includes silk. Silk, it is nothing but it is a braided or twisted multifilament and it can be coated as well. Coated with wax or silicone. And what about the uses? It is used to ligate and suture when there is long-term tissue support. It is for the use of long-term tissue support, long tissue support. So what are the examples for securing drains? Secure drains. It is used for the 2-layer bowel anastomosis. Next, non-absorbable, we see the steel. Surgical steel. So surgical steel is nothing but it is monofilament, mono as well as the multifilament, and there it shows it is used in the closure of the sternotomy wounds. And then we have the nylon. Nylon is nothing but it is a monofilament as well as the braided multifilament. And where it is used in case of skin closure as well as the abdominal wall closure. Next, it is also used in case of the hernia repair and the neurosurgery. Then we move on to the another non-absorbable. It is the polybutyster. So the polybutyster, it is a monofilament, and what it does, it exhibits elasticity. So it is used in case of the plastic surgery. Then we have the polypropylene. So polypropylene, aka proline, it is nothing but a monofilament, and the uses being it is used in the cardiovascular surgery as well as the vascular anastomosis. Next, it is can also be used in the plastic surgery. Earlier we discussed plastic surgery. It is used, that is the polybutyster is used, and even the polypropylene can be used for the plastic surgery. And this polypropylene, it is also used in case of the surgical subcuticular skin closure.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.